So welcome everyone. It's my pleasure to have everyone come for this celebration of the 125th anniversary of X-ray arriving in Kingston. We're going to be taking you on a whirlwind tour through the decades since X-ray first arrived in Kingston and show you some of the amazing advancements that have happened in medical imaging in that time. And we'll introduce you to some of the interesting characters who have taken part along the way. We hope you gain an appreciation for just how important medical imaging has become in the management of patients. To kick things off, I'd like to introduce the President and CEO of Kingston Health Sciences Centre, Dr. David Pecora, who is not just the President and CEO, but also an accomplished surgeon in his own right. So, Dr. Pecora.
Well, thanks very much and welcome everybody. It's a pleasure to be here and welcome you and participate in this event tonight. It's great celebrating our history. As some of you would know, our KGH and Hotel Dieu sites are the oldest operating hospitals in the country. From the 1840s is when they were both founded. And so it's a pretty rich and exciting history. But we're very actively trying to move into the future and think about innovation and advances in care. And diagnostic imaging plays a huge role in the advances we're making right now and what we anticipate for the future. I haven't been here for all 125 years, although some of my colleagues would suggest that might be possible. But I did arrive as a medical student in the late 70s. As a clinical clerk and then an intern. I remember when the first CT scanner went in, when we were just kind of getting going on nuclear medicine. And I practiced for quite a number of years with X-rays that you can hold in your hand and how we would use those in practice and for teaching. And we thought that transitioning to digital computer-based X-rays would be impossible and a real step backwards, but obviously that hasn't been the case. And it's been remarkable to see the advances in diagnostic imaging just in the few short years since KHSC came into being in April of 2017. We now have 2 state-of-the-art MRIs, the only 3T in the region between Toronto, Montreal, and Ottawa. And I think it probably still is the most advanced 3T in the province. We've moved into a lot more sophisticated interventional radiology with a whole host of neuro-related procedures. EVT and coiling are good examples. And then just last week, we opened our new hybrid interventional operating room in the OR suite on Connell 2. And it has the most modern hybrid imaging suite that there is today. And it's a huge advancement for minimally invasive procedures like EVARs and for aortic replacement and TAVI for percutaneous aortic valve replacement. So a real exciting history and things that are happening right now. And we're busily finishing off the construction of our breast imaging center offsite near Highway 15, which will be the most advanced breast assessment program, I think, in the country when it opens. So we're really excited about that too. So again, welcome, lots to celebrate here, and I hope you have a pleasant evening and event.
Thank you very much, Dr. Pecora. For those who don't know me, by the way, my name is Ian Silver. I'm one of the neuroradiologists here in Kingston. It is a great pleasure for me to be able to introduce our keynote speaker, Dr. John Schreiner. Dr. Schreiner is a medical physicist. He received his PhD from the University of Waterloo in 1985 and then went on to get a position at McGill University and eventually in 1997 became a medical chief physicist at Kingston Health Sciences Centre or Kingston General Hospital, and then retired just a couple of years ago after a long and storied career. He was an adjunct full professor in oncology and physics, engineering physics and astronomy at Queen's University, and also had an appointment at the Queen's School of Computing. His accomplishments are many and laudable, and his CV is too long to recite in full here. But he's been invited to over 100, given over 100 invited lectures, has many publications, but he's most proud in particular about two accomplishments, which was introducing researchers internationally to 3D dosimetry, as well as to having supervised over 120 trainees, including 8 PhD students and 27 master's students, as well as I think it was about 25 PhD candidates he was invited to attend at their defense, including internationally. He's published over 115 peer-reviewed papers. So without further ado, let me introduce Dr. John Schreiner, who will tell us the story of how X-ray first came to Kingston.
Thank you, Ian, for those kind words. And I'd like to thank Dr. Islam and the organizers for inviting me to this celebration. Slides aren't moving yet. Nope. Oh, there we go. Thank you. So, X-rays came to Kingston about 125 years ago, and I'm going to tell you a little story about how that happened. This past November 8th was the 126th anniversary of Wilhelm Conrad Röntgen discovering X-rays. And over the next 7 weeks of that year, he spent a lot of time studying the properties of these new rays, which he reported in a paper and also in some letters that he sent to some colleagues. And what happened was it made the news in early January. And within 8 weeks of that news, Kingston actually made some X-ray news for Canada here. So Dr. Röntgen was doing basic physics research. He was not looking for an imaging technique. He was trying to understand a particular physics problem, and he was working at a university in Bavaria, Germany. And the problem he was trying to understand was rays in a particular type of instrument called a cathode ray tube. And these rays existed within this instrument, and they could travel a centimeter or so outside the instrument, but they were very localized. We now know that these rays are electrons, but at the time, nobody knew what they were. And he was doing, as many other physicists in the world, he was studying these rays. But what he discovered, which was unique, was that there was another thing happening in these in these cathode ray tubes. And another type of radiation was created that was traveling large distances. So it could light up crystals that were across the room. It could actually, if you put an object between those rays and a photographic plate, it would actually expose that plate and make a record of what was between the tube and the plate. So he had these new rays. They were traveling long distances. They were unknown. He called them X-rays. And as he studied their properties over the next 7 weeks, what he discovered was, depending what was between the cathode ray tube and the film, would give different types of images. And you would get these shadow graphs that seemed to be able to penetrate and look inside. And one of his experiments, he was holding a plate and he saw the bones from his hand. And later on, he asked his wife to come to the laboratory, and he took what is perhaps the most famous X-ray picture of her hand sometime late in December. Now, this work was quite exciting. By the end of December 28th, he decided he would publish a paper. He submitted a paper to the local proceedings of the scientific organization in Würzburg. And he also subsequently sent a number of the photographs that he'd taken, copies of photographs, to friends. And I'll say more a bit about this in a second. He did report this in one meeting towards the end of January, So he did give one scientific talk about this discovery. It was the only talk he ever gave. And that talk actually generated the second most famous X-ray picture. One of the attendees was a famous scientist from Switzerland who asked if he could have his hand photographed. And they did that at the end of the lecture. And that's this picture that you see here on the right. For this work, Röntgen won the first Nobel Prize in Physics in 1901. Just to show what kind of character he was, he gave all the money from that prize to the Würzburg University. He also never patented his discovery, wanting to make sure that it would be used as much as possible by the world. Now, how did this make the news? Well, as I say, he published the one paper. He only published 3 papers on X-rays in his career, but the first one was finished on December 28th. On New Year's Day, he mailed the copy of that paper and these photographs to 12 other physicists. And one of the physicists was a famous physicist, but also a friend and colleague. They had worked in Zurich together, and he was in Vienna. And when he saw these pictures, he thought, this is really exciting. And the next night, he had a dinner party. And he had to show the attendees to this party, this amazing discovery out of Würzburg. So he shows the pictures around, everybody's amazed and astounded. And one of the people at the party was a visiting physicist named Ernst Lecher. And Ernst asked if he could borrow those photographs for one night. He brought the photographs home. He showed them to his father. His father was the editor of the main newspaper in Vienna. And the next day, it hit the news in Vienna. It was the first page story of this discovery. And within days, it was hitting the news throughout Europe and within weeks in North America. And in many of these articles, there would be these statements saying, this seems like an April Fool's joke. This seems like fantasy, but this is good science from a German professor. So it was really moving forward. News came to Canada, and by the end of January, there was actually some reports in Toronto papers. On February 5th, there was a report saying physicists and physicians here in Toronto are hoping to do these studies soon. And on February 8th, it also hit the news with Kingston's main newspaper at the time, the Daily British Whig. Now, one universal observation in the news, in all the public media, and in the scientific discourse at the time was this was going to transform medicine. This was providing physicians with a way to do diagnosis where they would not have to do any cutting or probing or pushing on the patient. This was a new way to do medicine, and there was a lot of excitement that was coming about. So in North America, here's a few of the first X-rays that were taken. The first medical X-ray was done in New Hampshire. And again, it was a physicist who had the cathode ray tube. He'd been working on cathode rays. He read the reports on Röntgen, and his brother happened to be a physician. And a young boy had broken his wrist while skating, and the physician asked his brother, "Can I take a picture of that wrist? Let's see what it looks like." And what makes this incident really interesting, much of the early work on X-rays was done by photography clubs and camera clubs. And one of the people in the room while this session was happening happened to be a photographer. And the picture you see here is an actual photograph of that X-ray session. 2 days later, at McGill, an X-ray was taken of a patient who had been shot in the leg 2 months previously, and they hadn't been able to remove the bullet because they didn't quite know where it was in the leg. So a surgeon approached the head of physics at McGill, Professor John Cox, and they took an X-ray, a 45-minute X-ray, and they were able to locate where the bullet was and then do the surgery to remove the bullet. So this is one of the first instances of X-rays being used to guide a medical procedure afterwards. It also was one of the first uses of X-rays in court, because the victim sued the assailant, and this X-ray photograph was used in that trial. The news of this McGill experiment and exposure made the Kingston Daily British Whig on the next day. And there was nearly a third of a column of that experiment detailing what happened. But Kingston really made the news for X-rays in Canada on February 17th. And on that day, there were a number of articles on X-rays and on other things that were happening in Kingston. So there was one short line saying these cathode rays are being used to investigate were used yesterday to investigate a needle in a patient in Toronto. So again, people trying to guide surgery with it. But the real news, and the Kingston news, was that a professor at RMC, Captain John Bray Cochrane, had been asked to take an X-ray photograph of one of the most famous Canadians of that time, Madame Emma Albani, who was an opera star. She was from Quebec, had made a huge career in Europe and in North America as a soprano. And she was one of the leading stars of music at the time. She was the Adele of her time. And she had been visiting Kingston. She was in the news practically every day, all of February. And she had gone to RMC visiting somebody there, had been shown some of Dr. Cochrane's work, and she convinced Dr. Cochrane to take an X-ray. So this news made the February 17th Whig, and in the Whig there were two things. One, a short paragraph saying she really wants to have an X-ray taken, and then a paragraph a little later saying she had her X-ray taken. The X-ray actually appeared in a publication a few months later. It was a publication that Captain Cochrane published in a journal on jewelry. It was the Jewelry Circular, and he was writing a paper on how you could use X-rays to determine the veracity of precious stones. So he published the picture of Madame Albani's hand, which is here on the right. 3 days after the report about that exposure, there was a long, full paragraph in the Kingston Whig detailing much of Captain Cochrane's work, saying Captain Cochrane's been looking at these X-rays since they were first announced in January. He's an expert, and he has actually done some experiments on his own and discovered some new things. So he was a recognized expert. Over the next few months, he continued to show the potential of X-rays, taking photographs of many X-ray photographs of many volunteers. At one point, he was asked by a surgeon at the Montreal General, or at the Kingston General, sorry, on May 1896, if he could help guide some surgery with a patient who had a needle in her hand. It was so swollen that they couldn't figure out how to get at this needle. They took 2 X-rays, and again, it guided the surgery. So this experience from Captain Cochrane really motivated the Kingston General to acquire an X-ray system. It was the second hospital in Canada to permanently have an X-ray system on site. The hospital also hired Dr. James III to take over this medical X-ray work. And Dr. Islam is now going to continue this story as X-rays come to the hospital.
Thank you very much, Dr. Schreiner. That was a fantastic and fascinating story. I guess if Madame Albani was the Adele of the time, does that mean the British Whig was the Twitter of the time? As you mentioned, Dr. Islam is going to be our next speaker. Dr. Islam earned his medical degree from the University of Toronto in 1995. Sorry if I just outed your age there, Omar. And came to Queen's for his internship and residency. He completed his fellowship in neuroradiology from Yale University and returned here to Queen's in 2001 as an assistant professor and section head for neuroradiology for many years. He has taken over more recently as department head, and he has been implementing some substantial changes that are moving the department forward in a big way. So we're looking forward to all the new changes that he's bringing along. So without further ado, Dr. Islam.
Thank you very much, Ian. Thank you to Dr. Pecora for the introduction as well. I'd like to also say special thanks to Dr. Schreiner for the talk. Thank you for the wonderful information and tidbits on our history here at KGH. And when you first wrote that article about a year ago in the WIG, I contacted you thinking, this would be great to have an event and share this with everyone. And so here we are today. So thank you very much for that. I also want to give a special thanks to another guest speaker who you will be hearing from shortly, and that's Dr. Bob Nolan. Some of you may know Dr. Nolan. Bob's been a good friend and a colleague for many years, and he was a former department head, and we're going to be hearing from him shortly about his experiences and point of view as far as history is concerned. I believe she's on the webinar, Dr. Annette McCallum, who was our former department head, and as a historical fact, she was the first female department head of the Department of Radiology. So welcome, Dr. McCallum. And good news, we have about 10 female radiologists in our department out of 28. And so the future looks bright for one of them to be the second department head, female department head. And of course, I'd like to also thank the Museum of Healthcare for hosting us, and Warren Lee, Pam Moore, who are also going to be coming up shortly to share with you some more tidbits upon when it's their turn here. Let me start with my slide. So I'm going to keep it really brief and hopefully a little bit of an interactive component as well. So I'd like to begin with this slide here. And on the top right, you will see a picture of Watkins Wing. So this is the original wing of the hospital, and made in, I believe, 1836, so long before radiology came here, at a cost of £4,000. So Dr. Pecora will like this because we're just about to embark on a huge project which will cost up to $1 billion for hospital expansion. So can you imagine doing that for £4,000? And it was generously donated by Mr. Watkins, who I believe was a upperclassman who lived here in Kingston. Also, you can see in that picture in the front end, that rounded structure is the original Fenwick Surgical Auditorium. So that was donated by Dr. Kenneth Fenwick, who was a surgeon in the late 1800s, so 1890s approximately. And that cost, if anyone wants to hazard a guess into the chat box, they can do that and we'll see if you're correct. But that cost a fair penny at the time, but we'll see if anyone can hazard a guess, and I'll probably reveal that in a few minutes. Let's move on. So as Dr. Schreiner said, in 1896, Kingston General Hospital was one of the first hospitals, it was the second one, to acquire an X-ray machine. And this was really 2 months after Röntgen. So this is amazingly short time. The news spread across the Atlantic, and of course the technology came here to Kingston quite soon after Röntgen. This is the reproduction of the first X-ray apparatus that KGH purchased, and it's here for display in the Museum of Healthcare. So a really cool contraption with a large generator and a small cathode and anode in this part here, and then here's the hand. and the patient fell off and the hand remained because there was so much radiation. So this is the first X-ray of a volunteer at the Kingston General Hospital, and this was in Dr. Milk's senior collection, who was the father of the co-head of the OB department at HDH, Dr. Milks Jr. And so I just have a question for people. So how long did this X-ray take to generate? And I'll give you a relative time frame for how long it takes currently. So a current X-ray takes 21 milliseconds to generate. And so this X-ray obviously took longer. Now the question is how much longer? And I'll mention that at the end here. This was John Cochrane. So John Cochrane was not a radiologist. He was a professor of physics and chemistry at RMC, and he was the first one to build and test and trial the X-ray apparatus here in Kingston. And this was, he had several publications, and this was one that was published in May 27, 1896 in our WIG. And he talked about this person, Miss Hooper, who got a needle stuck in her hand. And so, he wanted to find this needle. So he X-rayed her, and it took 12 minutes. And that exposure showed where exactly the needle was in her hand. And this was used by one of the surgeons at the time to assist him in operating on this patient and taking out the needle. So this was, to our best of our knowledge, the first case in Kingston in which the X-ray has been used to assist the surgeon in his work. And this was the surgeon, Dr. Roland Kilbourne, who was the first surgeon to use X-rays in Kingston to guide surgery. So this was published in the Kingston Medical Quarterly. This was the first issue in October 1896. No doubt the surgeons of the hospital will, by this means, be greatly assisted in their diagnosis of obscure cases. So this was a prophetic statement, sure. Let me skip over this to James III. So James III, we could call as our first radiologist. So he was actually a medical superintendent who joined the hospital in February 1896. And under his direction, the hospital purchased its first X-ray machine. And it was published in the Daily Wig because it was a big event. And here's an example of, or here is the picture of one of the first X-rays taken. And it's a piece of beauty, actually. And this is X-ray of a tuberculous joint, and it's supposed to show rarefaction of the bones and soft tissue swelling. But I can't see it, but I guess it's there. But at the time, this was considered, a dramatic advancement, of course. So Dr. James III pushed Cochrane aside. So he elbowed Cochrane out, and as a superintendent, he took over all the radiology here at KGH. And in 1898, he reported 241 X-ray exams being performed. And he was actually quite an academic. He wrote for the Kingston Medical Quarterly and started publications on all the uses of X-rays. And he used to give talks and demonstrations on X-rays. He was also the first person in KGH to use X-ray as a fluoroscopy unit. And October 4, 1987, he said that the patient could be placed between the X-ray tube and the fluorescent screen, and allowing for real-time observation of the patient. And they used this to look at the patient's heart and the lungs. So, so he became so engrossed with X-rays that he quit his job as the medical superintendent, and he was appointed as the first radiologist for KGH on September 13, 1900. And we like to joke about this, that even back then, everyone wanted to become a radiologist. And so he was the first example of that. So he, in 1902, his article on some of the diagnostic and therapeutic uses of the Röntgen rays was actually quite comprehensive and widely published. And he was a big fan of collecting data, and he had 6 years of data on the various uses of X-rays. And we could say he was the first AI scientist of Queens with all the data he had. So he published on using this for foreign body detection, bullets, needles, coins, also for identifying disease such as TB and rickets. And he used a fluoro machine to guide X-rays for heart issues. So this is what he wrote. He said, among the diseases that are said to be amenable to X-ray treatment. I can speak with confidence regarding the following: lupus, rodent ulcer, cancer of the lip, psoriasis, and cancer of the breast. However, he was a smart man, and he said, as a therapeutic agent, the outlook is hopeful, but let us make haste slowly. Let us consider it a valuable adjunct to other means of diagnosis, rather than a keen competitor for supremacy. Excuse me. We must not abandon the old method of drawing conclusions by a process of inductive reasoning after a thorough and searching examination. So he basically was saying, that don't discount the physical exam and the clinical acumen, which holds true today, of course. He was also adamant that X-rays were for specialists only, and he said that these should never be placed in the hands of the patient. Three things: the hypodermic syringe, the thermometer, and the X-ray photograph. And finally, just a couple more slides here. So this is one of the first electrostatic generator X-ray machines that came into use, and this was donated by Dr. Frank Mello, who was a medical school graduate in 1902. By the way, the medical school fees at the time was $2 a year. So can you imagine that? So this machine used to, with the wheel on the right, used to spin that and generate electrostatic current. And then you would place the hand or other body parts here and expose the patient for X-ray. By the way, the amount of dose was about 75,000 times the current dose. So one X-ray, for example, currently takes 0.1 millisieverts of energy into the patient. This was about 75 sieverts, sorry, millisieverts. Short time. So one last point before I pass it on. One of our first department heads at both sites was Dr. Quigley. In 1909, the Brock wing opened at Hotel Dieu, and Dr. Quigley was the department head. Here's the cathode tube from 1918 that Dr. Quigley used in the department, and the handheld 402. Lastly, this is interesting. So in 1930, we jumped to 1,800 cases of private patients and 587 cases of indigents. And so over 2,000 people were X-rayed. So a significant jump from the early days. Thank you. Ian?
Thank you very much, Dr. Islam. It's funny that anecdote you told about Dr. Third emphasizing the importance of physical exam and X-rays being used as an adjunct. There has been some change over time, I have to say. I remember when I was a medical student on a rotation in internal medicine, and there was a senior internist who was an expert in physical exam and taught us rigorously how to do a physical exam. But when he'd see us auscultating a patient with our stethoscope, he'd say, throw away that guessing tube and get me some imaging. So our next speaker, who's going to cover the next 2 decades, is Mr. Warren Lee. Warren graduated from the X-ray program at Queen's in the Eastern Ontario School of X-ray Technology, and actually gave some instruction to the last class at that school. He's worked as a medical radiation technologist here since 2008, despite his original plans. He quickly distinguished himself as an outstanding technologist and leader, and he's got experience in multiple different areas in imaging, including X-ray, MRI, and interventional radiology. And he's currently the senior technologist in general radiology at KHSC. So without further ado.
So good evening, everyone, and thanks for tuning in. My name is Warren Lee, and thank you for the introduction, Dr. Silver. It is with great privilege that I can present on the history of X-rays in the Department of Radiology over the 1935 to 1955 period. It was in this 20-year interval in different radiation in different forms was utilized and applied therapeutically. The growth of radiotherapy and advancements in this field became characteristic of this time period. In the interest of time, I will highlight 3 advancements before focusing on key events in Kingston related to this era. So the first advancement of this era was the Betatron. Developed and refined by American physicist Dr. Donald Kirst, the Betatron applied the use of accelerated electrons to create high-energy X-rays. This form of radiotherapy utilized the high-energy X-rays to target and kill cancer cells. And in 1948, this was medically applied and used to treat a brain tumor. Cobalt teletherapy is our next advancement in radiotherapy of this era. In the late 40s, multiple scientists and researchers, including Dr. H.E. Johns, Dr. Gilbert Fletcher, and Dr. Sampson, Dr. Ridnour, and Dr. Bleakney were all associated with the radioactive use of cobalt-60, the isotope for therapeutic action. It was after World War II that this isotope could be harnessed from nuclear reactors, and a practical source of cobalt-60 was available. Gamma rays produced from this isotope was ideal for destroying cancer cells as well. It was in 1951 that the first cobalt treatment was applied in London, Ontario, Canada. And our last advancement of this 20-year period that I'd like to talk about today is brachytherapy. To define it simply, it is the insertion of a radiation source, in this case radium, directly in or near a tumor for therapeutic treatment. It was in the late 40s and early 50s where Dr. Fletcher, working alongside physicist colleagues in Houston, designed a preloadable colposet for radium. This device facilitated radium treatment of cervical carcinoma and became a viable brachytherapy option at this time for this type of cancer. These are but some of the wonderful applications of X-rays and other forms of radiation. So switching gears, Kingston, Ontario was also experiencing many growth opportunities and changes during the mid-40s to mid-50s. As stated previously by Dr. Islam, in the, I think, 1915s, late to early 30s, about 2,000 patients were imaged. The Department of Radiology at KGH was growing. Dr. William A. Jones oversaw operations as its director. In 1946, Dr. Ronald Burr became the charge radiologist at Hotel Dieu Hospital, and the chief technologist was actually Sister Elizabeth McPherson. In the advancement of in the field of X-ray technology, the first X-ray student was at Hotel Dieu. Her name was Blanche Olson Kennedy, and she started her studies in 1951. And 5 years later, she succeeded Sister Elizabeth McPherson as the next chief technologist. And going back to how things have grown in the Department of Radiology at this time period, the average number of patients imaged between 1949 to 1953 was just under 9,900 patients. Fast forward 3 years, the number bloomed to over 12,800 plus patients that tallied over 15,000 total cases performed. The last development to highlight in the 50s with relation to KGH was actually the division of the physical therapy and the radiology departments into 2 separate and unique entities. This was completed for the interest of medical expansion, and as stated previously, and as you can see, the workload had increased significantly, and this necessitated that change. At this point, I'd like to pass it on to Dr. Silver to highlight the next 20-year period for X-rays in Kingston and the Department of Radiology. Thank you for listening.
Thank you very much, Warren. So I've titled this section 1955 to 1975, 2 decades of growth, but as you've heard, the growth really has been since the beginning. I went through the annual reports, departmental annual reports over the 20-year period that I looked at, and I plotted on this graph the number of studies per year, and you can see visually the massive increase over this time period. On average, there was about a 9% growth in the number of cases per year, with a more than 5-fold increase over the 20-year period. This continually put a strain on resources. So even though they kept purchasing more equipment, demand was so much that it quickly outstripped supply. For example, in 1961, a new image intensifier unit was purchased, And by 1963, already a new unit was urgently needed because of demand was so high. I'm not going to spend too much time on this because we're a little bit behind schedule, but just love this picture. And this is an early version of the current Ontario Association of Medical Radiation Sciences. A brief note on Dr. Fransman, who took over as department head from Dr. Jones in 1960. He did serve as a chest physician at the Anguinata Sanatorium in Kingston until he was appointed to KGH in 1956. He also served at St. Mary's of the Lake and the Kingston Psychiatric Hospital and the Collins Bay Institution. He was instrumental in founding the Eastern Ontario School of X-ray Technology and also bringing the first rapid CT scanner to KGH, which happened a little bit later in 1977. There's an annual Dr. S.L. Fransman Prize in Diagnostic Radiology awarding to a graduating Queen's medical student entering diagnostic radiology residency that still exists to this day. And actually, I happen to have been one of the recipients of that. During this period, in actually 1962, radiotherapy got its own department. Before that, radiotherapy was part of, fell under the umbrella of radiology. And in 1962, Dr. R.C. Burr became the director of the Department of Radiotherapy. I want to focus on a couple of incredible innovations that happened during this time period. And the first I'll touch on briefly is diagnostic ultrasound. So this was introduced by Ian Donald, who is an obstetrician, and Tom Brown, who's an engineer. It's a technology using sound waves to be able to visualize tissues. The whole development of ultrasound happened incrementally, starting in the 50s, continuing through the 60s until in the 1970s, they were able to generate live grayscale ultrasound images similar to what we see nowadays. And this picture shows what ultrasound looked like in the early days with the patient in this gigantic contraption and the technologist looking at what looks like an oscilloscope. But this technology now everyone knows as the purveyor of people's first baby pictures. Here's an example showing forehead, nose, mouth. Here's a little hand clenching a fist. It's a young Cassius Clay here. And then on more modern ultrasound, we can see a 3D image showing a baby's face with the eyes over here, the nose, here's part of an ear, and the mouth and the hand, of course. The other major development during this time period was computed axial tomography. It's hard to overstate the importance of this development because it was, first of all, we were able to see some tissues that we weren't able to see before, and we were able to see inside people as never before. So this was developed by a British engineer called Godfrey Hounsfield in conjunction with a physicist, Dr. Alan Cormack. The work was done in EMI laboratories, and if EMI sounds familiar, it's because it's the record label for the Beatles. So not only did the Beatles provide us with the much wonderful music, but they also funded the development of this incredible technology. Both of these researchers went on to be awarded the Nobel Prize in Physiology and Medicine. Here is an image of the first ever clinical CT scan. So this was from a middle-aged woman who showed signs of a brain tumor. If you look, this white circle around the outside is the patient's skull, and then we have brain tissue, and this dark circle over here is a tumor in the patient's right frontal lobe. Patient's right is on our left. Modern CTs are a little bit more advanced than that, but I thought it would be worthwhile taking just a minute or two to explain how CTs work and how different they are from X-ray. So the patient lies on a table. There's an X-ray source shooting an X-ray beam through a patient, and on the other side, 180 degrees on the other side, there's a detector. And the detector records how much radiation, how much X-ray passes through the patient at that point, and the emitter rotates around 180 degrees. And by taking all that information about how much X-ray comes through the patient at each angle, the numbers are crunched by a computer and they're able to generate an image of a slice through a patient. And here's an example. This is a mock-up of a patient's chest with the heart being represented over here, the spine back here. The black bat wing-like things are the lungs. Here we can see some ribs in the chest wall. And if we were to shine an X-ray beam straight up and down through the patient, this is the image that we would see. Bright where lots of X-rays are absorbed through the heart and spine, dark where the lungs are. Now, if we shoot a second X-ray beam through the patient horizontally, this is what it looks like. If we do the diagonals, it starts to look like this, and you can kind of start to make out a blob where the heart is and another where the spine is. And the more angles you add, the clearer the image becomes. And I'll just show you in real time what this looks like. If you pay attention to the black box on your right, you're going to see an image being formed, and try to see how long it takes you to figure out what it is that we're seeing. The X-rays are going to start coming through horizontally, and then they're going to rotate through 180 degrees until the image is formed. And I think I just have to get rid of this laser pointer to be able to activate this. Here we go. And by now, most people can recognize that this is an image of a patient's head with the eyes at the front. Here's the lower part of the brainstem and the cerebellum, temporal lobes, and skull around. So I'll just move on. So before CT, you'd shine an X-ray through a patient at a screen or a detector, and you get basically superimposed shadows. And that was what the image looked like. So here's an image of an X-ray of a patient's head. You can't see any detail of the patient's brain. The eyes just look like empty sockets. So CT brings us from that to this, where we can see in exquisite detail the difference between gray matter and white matter, the ventricles carrying the cerebrospinal fluid in the brain, etc. So I'm going to hand the baton off now to our next speaker for the sake of time. So although radiologists and technologists are the more patient-facing roles in our department, the reality is our department would not be able to function with all the people behind the scenes making things happen, whether it's the registration clerks at the front desk or the booking staff who keep all the appointments filled. We can't do anything without all of this support staff. And our next speaker is a great example. Ms. Pam Moore has been coordinator of diagnostic radiology for almost 6 years now. She has a background in program administration and management, business and human resources, and completed her Master of Industrial Relations right here at Queen's. So I'm going to hand off to Ms. Moore.
Great, thanks, Dr. Silver. And as you mentioned, I am Pam Moore, coordinator of radiology. I'm going to talk to you today a little bit about 1975 to 1995. So the mid-70s really focused on ultrasound and CT and improving those areas because of the increase of patient demand. In 1976, KGH purchased its first CT scanner, which was largely driven by the increasing demands from neurosurgery. And in 1977, KGH became one of the first hospitals in Canada to operate a total body CT scanner. In 1979, KGH expanded its equipment and brought ultrasound onto its permanent roster. As we move into the 80s, Dr. Eric Sauerbrei, who's still with our department today, joined the team as a women's imaging radiologist. In 1982, quite a bit of things changed in the department. The Department of Clinical Engineering was created to service all of the departments within the hospital, including radiology. And to this day, they play a very important role in the success of our department through maintenance and service of equipment. They also brought in Alex McKinnon as the radiology administrator, who oversaw technical and administrative staff. Today, that position is the director of radiology and is held by Karen Pearson. Also in 1982, radiology found a new home on Kid 1, which is where you can still find the department located today. Similarly, in 1984 at Hotel Dieu, the hospital officially opened the Jean Mance wing and radiology moved in. So it was the first time since 1965 that the department had had any updates. They received state-of-the-art equipment and better facilities for patients, including change rooms and increased patient privacy. So again, to this day, Jean Mance is home to radiology at Hotel Dieu. A couple years later at KGH, we see the introduction of the bone mineral analyzer, which combined with blood work, x-rays, and routine checkups, helps physicians to better monitor, treat, and detect osteoporosis at an early stage. As we move into the late 80s, we see the development of a formal residency research project. This was driven by Dr. Eric Sauerbrei, who, as I mentioned, joined in 1980. So the development of this program now meant that research was a mandatory part of residency. So every resident had to complete at least one research project during their education. It also meant the development of project teams. So these project teams help to support the residents, evaluate research presentations, and coordinate funding. Also in 1989, we saw quite a bit of change, and one significant change was the department was renamed the Department of Medical Imaging. They now service all departments across both hospitals, and the Department of Radiology at Hotel Dieu and the one at KGH amalgamated under one single department head with 2 deputies at each location. So this was organized by a central imaging committee who worked seamlessly to integrate the departments. And by these departments coming together, medical imaging was better able to provide more effective communication to physicians and also faster and better service to patients. As we move into the 90s, the department brought in a lot more technology. Over the next 5 years, they saw their first MRI, a new CT scanner, additional ultrasound equipment, and new equipment necessary for enhancing the capabilities of nuclear medicine. At this time, in 1991, the Quest for Precision Radiography was also used to obtain the first images of lower limbs from the standing position. At this time, we also had 2 new radiologists join our team that are still with us today. In 1990, Dr. Frank Cheeseman, nuclear medicine, joined. And in 1991, Dr. Paul Fenton, MSK, joined the team. He actually just celebrated his 30 years with the department on November 5th. In 1993, the department went through a change again, and it was renamed the Department of Imaging Services, which is what it is today, one of its many known names. Other ones include the Department of Diagnostic Radiology and X-ray. In 1994, KGH got its first MRI machine installed and became one of Ontario's top diagnostic centers. And they also brought on pediatric radiologist, Dr. Don Soboleski, who is still with us today as our pediatric specialty lead and our resident research director. Lastly, we come to 1995, where innovation and department development were a central focus. So at this time, KGH performed its first MRCP successfully and also was putting a lot more emphasis on professional training and professional development. So there was a development of a program called Training in Partnership Program, which allowed radiologists and technologists the opportunity to improve both their knowledge and their skills via training through teleconferences. Thank you.
Thank you very much, ma'am. So the next speaker I have a great pleasure introducing is Dr. Robert Nolan. I'll be brief so that Dr. Nolan doesn't have to. Bob, actually speaking of history, Bob graduated from Memorial University of Newfoundland with a BSc about 2 months before Neil Armstrong first set foot on the moon. He went on to do medical school at Dalhousie University and radiology residency at Memorial, completed a fellowship in diagnostic ultrasound, and did additional training at Duke University in cardiothoracic, or did a visiting professorship there in cardiothoracic imaging, had a long and illustrious career with our department, including a stint as department head from 1992 to 1996, after having been acting head for about 1.5 years before that. He's a personal mentor of mine, and it was a great pleasure to welcome him to the podium. Bob?
Thank you for the introduction. The topic is obvious to anybody who's looking at the screen. The image, of course, is that of Madame Runken. You can appreciate that even though this was taken only approximately a month before the X-ray taken in the Kingston General Hospital, there had been tremendous improvement in image quality over a very short time. This image is one, sorry, so I was going to say the presentation that I'm going to give you is basically my biased perspective of the recent past since 1984, which is when I arrived in Kingston, the present, and perhaps a little bit of view of the future of the Department of Diagnostic Radiology. I've been retired for some years, so therefore most of my slides have been borrowed from Dr. Google, with some local cases thrown in. And these also basically reflect my personal biases and interests in some topics. This slide is symbolic, I think this slide is symbolic of my vision or my view of the department when I arrived in Kingston. In Greek mythology, Zeus punishes Sisyphus by having him push a rock uphill for eternity in the underworld. It reminds me of the radiology department because the situation in Kingston wasn't so good for radiology in 1984. Hospital administration perceived that radiology was a liability, and they didn't like radiology very much. The feeling was mutual. Radiology didn't have much interdepartmental support from other departments as well, because everybody was competing for funding. So as you might conclude, that this situation was not conducive to a progressive, evolving department. As a result, there was very little investment in capital equipment. These statements represent my biased opinions of the department in 1984. Everybody may not agree with these. It was a successful radiology training program with good clinical teaching. Academic productivity and research were weak. Technology was very outdated. Oops. 1989 was the ultimate low in the department's history. The department received a provisional accreditation with notice of intent to withdraw accreditation after external review by the Royal College. It was primarily due to outdated equipment and many complaints from the residents to the Royal College. Dr. Duncan Sinclair, who was Dean of Medicine at the time, requested a plan. Indeed, he demanded a plan. Eric Sauerbrei and I were given the task of collating a plan for new technology, and we presented it to the board of directors of both the KGH and Hotel Dieu Hospital. It was eventually approved, new technology was acquired, and I say this in the context of a successful radiology training program. As a result of this process of our recent history, amalgamation of the KGH and Hotel Dieu radiology departments occurred administratively in 1989 and functionally evolved after 1990. This slide, again, a little bit of symbolism here. Dark clouds start to pass away. There was some brightness in the sky. The future looked better. We acquired some new technology, including radiography equipment, ultrasound, CT, MRI. We received full accreditation on the next review as a result of these changes. Prior to 2005, our work process basically was hard copy films on view boxes, dictaphones. We would dictate reports, redictate them to make corrections, sometimes 2 or 3 times. Report turnaround time was 2 or 3 days. In 2005, PACS arrived. We were viewing images on computer screens. Data was merged with the images. Eventually, voice recognition evolved and report turnaround time dropped down to typically hours. Amazing difference. And I think at that point, radiology started to get a little bit better reputation within the community because people could actually access reports in a timely manner that it would make a difference to decision-making in patient care. which was something that we did not have before that. Few comments about ultrasound. When I arrived here, we had real-time only, then we got some spectral Doppler, and by 1990, we obtained color Doppler, power Doppler. We were doing early work on tissue characterization and eventually 3D reconstruction. The current state of ultrasound is also allowing for some therapeutic options of focused ultrasound, open the blood-brain barrier to allow drugs to get to brain tumors, focused ultrasound to treat prostate carcinoma and brain neoplasms. We aren't doing those here, but they are being, there's been work done on these things in several centers in Ontario. Just a couple of pictures from ultrasound. You can see in the upper right corner, exquisite image of a baby's face. And this is used when we're trying to look for anatomic abnormalities such as cleft lip and cleft palate. And this is basically, you know, the kind of wonderful 3D reconstruction imaging that you can get today on today's quality ultrasound. In the bottom left, you can see an abnormal view of the liver where certain areas are whiter and certain areas are blacker. There are two biopsy specimens here. One is showing normal liver, the other is showing fatty liver. This is a very early example of using ultrasound for tissue characterization, and a lot of progress has been made in that regard today as well. Other major development in ultrasound, I think, has been the optimization of vascular ultrasound. In the upper right corner, you will see pictures of a carotid artery. There's a lot of research being done today, for example, on intimal media thickness as a predictor of subclinical atherosclerotic change. And it's basically a hot topic. On the bottom left, you can see the use of spectral and color Doppler. It's actually a combination of 2D imaging with color Doppler showing a significant stenosis in an internal carotid artery and spectral broadening and abnormal waveform at the bottom of that same picture. So these basically are combining imaging with physiologic functioning, because you can get an estimate of how severe the stenosis is and the need for management of that, you know, whether it be surgical or otherwise. I'm just going to jump to CT here now. Oh, CT. I'm not sure that I may have gotten some incorrect dates compared to what was said earlier. I had recorded that we had received this single slice total body scan in 1977. It was supposedly the first total body scanner available in Canada. Now, this was supposed to be great, but I can tell you, in an emergency situation, it took forever to see the images. It took anywhere from 30 to 40 seconds to see each slice of a scan. You could be waiting 30 or 40 minutes to see those images before you could give a diagnosis. In 1986, we acquired a helical scanner. 1996 plus, we developed technology, including multiplanar reformation, CT angiography, and 3D reconstruction. In the top right, for example, we see a lovely example of exquisite detailed anatomy of the aortic valve on multi-format reconstruction. The bottom images are 3D reconstruction of the heart and coronary arteries, in this instance, relatively normal looking. But you can see the potential of CT for detailed anatomy assessment, which has direct therapeutic applications. For example, here's an example of coronary CT angiography. On the right are images of the coronary arteries. There is a severe stenosis of the proximal LAD. The middle images show CT reconstruction of the coronary artery showing the same degree of stenosis. And on the left, there is the stenosis of the LAD on 3D reconstruction. Time is, we're tight for time, so I'm going to skip over some of these slides very quickly. Nuclear medicine in 1984 basically was a museum of nuclear medicine technology. 1991-93, we acquired SPECT-CT. We are expecting to have a PET-CT in 2023. Slides to the left are standard bone scan, old school technology. Slides in the middle and right are from a SPECT-CT showing much greater detail with 3D reconstruction as well. Nuclear medicine also has the potential to show functional imaging. And again, I've used a cardiac example. There's 3D reconstruction showing a tight stenosis of the LAD. On the right is the angiogram of the similar lesion. In the middle are SPECT images showing an area of dropout of the radioactive substance in the anterior right ventricular wall, consistent with decreased perfusion of the myocardium. This slide is an example of CT PET and MRI PET. They both have similar image quality. The advantages and disadvantages basically and this is what is being done for a bone lesion in the proximal left femur. They have similar image quality, and the limitations and advantages of each are basically dependent on the CT and MRI component. This is an MRI of a prostate showing a focal lesion in the left peripheral zone of the prostate, consistent with a prostate carcinoma, and the other images are also part of a protocol that's used for prostate carcinoma. So this is the best, perhaps the best way to make a diagnosis of prostate carcinoma. SPECT and PET are better for staging of prostate carcinoma. Interventional radiology, we had no dedicated service in 1984. A few of us were doing some odd interventional procedures. We had an old fluoroscopy room and film changer. First interventional radiologist was recruited in 1991, the second in 1992. We had dedicated IVR suites in 2010 and 2012. We currently have 4 interventional radiologists. They're victims of their own success. They're swamped with work. A third MRI suite is planned for 2022. Okay, so I'm going to have to skip to a couple more than 2. 2021 and to the future. There is currently an active research program, including artificial intelligence research. There is a new breast imaging center being developed in Kingston, which is a program which involving the anterior breast screening program and the Health Sciences Center. It's going to have state-of-the-art equipment and will start to function in 2022. The department is also involved with portable MRI services to Moose Factory, Winnebago, using a hyperfine portable MRI. PET-CT is planned for 2023. This slide is, my attempt at sort of trying to put a formula on something. The best situation is when you have visionary leadership. And I think that the current leadership has been forward-thinking and visionary. It is also involves having faculty members who are interested in academia and research, and who are collaborative in their activities, and having a supportive administration. I think all of those factors are present at the present time. And so one point is that the most important factor for the future success of a department is the faculty. We have old and new faculty of different skills and interests. They're all important and all contribute to the ultimate goal and success of the department. Administrations change, leadership changes, but the faculty evolves. And in the context of the radiology department, if the faculty are working in a coordinated manner for a common goal, then the department will be very successful. The last image is that of a jet going through the sky. And this sort of is my take on the progress of the department since 1990. We've gone from our worst days and darkest days, and we've gotten better and better. And I would like to conclude by just making a comment. There's a quote that I have always enjoyed. It goes as follows: "It is difficult to make predictions, especially about the future." This quote is variously attributed to Niels Bohr, Mark Twain, and Yogi Berra. I think that this is a good representation of the evolution of the department since 1990. Based on this trajectory, the best is yet to come. Time will tell. Thank you very much for your interest.
Thank you very much, Bob, for bringing us into the future. Just to conclude my talk, I had asked a question at the start on how long did it take for the first X-ray to be obtained way back in 1896. So we had a response in the chat and it said 12 minutes, and that was close. It's actually 90 minutes, 90. So that's equivalent to 20 years of background radiation exposure. So all in one 90-minute X-ray of your hand. So for comparison, currently takes 0.21 milliseconds, and it's an X-ray exposure is equivalent to 10 days of background exposure. So certainly we've come a long and dramatic way in 125 years. So before we conclude, I'd like to just ask Kevin Moorhouse to come up from the Museum of Healthcare, and they've been very gracious in hosting us here. And we have a couple of days of tours arranged for radiology artifacts, some of which you can see behind me, but they're all over here. So it'd be a very, I think, fun and interesting tour that I'll let Kevin speak to you about. Kevin.
Hi, everyone. I won't take up too much time because I know we're running late on time, but I just wanted to, my name is Kevin Moorhouse. I'm the museum manager and program director at the Museum of Healthcare. You might have seen our logo on the front of the podium here, or you might have seen some of the items in the background. If I could spin the camera around, you would see we're in our Century Gallery in the Museum of Healthcare. So it talks about some of the big leaps forward in the medical community during the 1800s to the 1900s. So if anything today or during this talk has sort of piqued your interest, if it's something that you've heard something and thought, wow, this would be fantastic to know more about, you're in luck, because there is a free by donation museum in Kingston that you may not have known about, in the Museum of Healthcare. So we have over 35,000 artifacts that cover X-ray, radiology, and everything in between, everything you could possibly imagine that's been in or out of a hospital. We probably have one on display. So if that piques your interest, if you're interested in anything like that, I encourage you to check out our website, museumofhealthcare.ca. You can just Google us. I think in the chat it's going to be placed the link to those tours that are running for the next couple of days. If you'd like to pop by and see some of the interesting artifacts that we've set out for radiology and X-rays and sort of the history of that, then we've got some things set out. You can come by and try your hand at trying to figure out what some of the X-rays are. It's always a fun game that we can even do even with our staff members sometimes too. So thanks again, everybody, so much for paying attention today, for checking out the Museum of Healthcare if you have a chance. And I'm going to turn it over to our MC to finish off the evening. Thanks again.
Thank you so much, Kevin. So we're really over time here, so I'll keep it brief. First, I want to just, again, thank you, Kevin, and the staff at the museum for hosting this event and organizing the tours. It's a fantastic venue. I encourage everyone to come check it out. I'd also like to thank the audience for being patient as we went over time. I'd like to thank all of our speakers, especially our invited keynote speakers, Dr. Schreiner, Dr. Nolan, and also to Mr. Gary Buffett from Strategy Management and Communications at KHSC for helping organize everything behind the scenes, and to Dr. Pecora as well. And of course to Ms. Pam Moore for putting everything together and keeping everyone on track. Just in closing, the story of radiology is a story of incredible innovation, and that's reflected in the fact that approximately 25 individuals have been awarded Nobel Prizes for discoveries related to radiology. Some of these have been in physics; those are outlined and highlighted in yellow. Some in chemistry, highlighted in red, and some in physiology and medicine, highlighted in green. we've come so far from first being able to see the bones in a hand and pick up a needle in the soft tissues of a hand, to now we can see a 2 millimeter nodule in someone's brain without having to open them up and without even having to use any radiation. It's just frankly incredible. It amazes me even now. Every day I come into work, I'm blown away by what we're able to do. And who knows, maybe we're not that far away from fitting all that medical imaging equipment into a small device like we see in Dr. McCoy's hand over here. So we'll close it out like that. And thank you again, everybody, and to all the speakers.